Welcome to Nasdaq TradeTalks. I'm Jill Malandrino, global markets reporter at Nasdaq. Joining me for this segment, we have Trevor Martin, co-founder and CEO of Mammoth Bio, to discuss how CRISPR is transforming healthcare, AI is being leveraged, and the future of genetic medicine. Trevor, it's great to have you with us. Welcome to Trade Talks.
Yeah, thanks for having me on. It's great to be here.
You got it. What is CRISPR and how is it transforming the world of healthcare?
Yeah, so CRISPR is a technology that allows us to program the code of life, so that's DNA and RNA, in a similar way to how we program computers. And that's a really powerful concept because it allows us to go after what's actually causing disease rather than going after and treating the symptoms. So when you think about all of our cells, they have DNA in it, and sometimes mistakes in that DNA are actually causing diseases that we deal with. So what CRISPR can do is it can actually go into the cells, and then it can actually find the specific sequence of DNA, so that's the code of life, A, T, C, and G, that's causing a disease, and it can actually fix it so that you can actually go after the root of a disease and actually even think about things like potentially curative therapies.
This might seem like a silly question, but what is CRISPR? Is it a solution? Is it a technology? Is it a laser? How does it work?
Yeah, so it's actually a protein. So our bodies have all sorts of proteins in them. So this is, you could hold it in your hand. You'd hold a lot of them in your hand. They're very small. You wouldn't be able to see them with your eye. But these are actually proteins. You can think of them as like kind of tiny molecular machines. And these proteins do all sorts of things in our bodies. But this one is actually specifically engineered and designed so that it can go to this very specific sequence, and it can be kind of programmed, this tiny molecular machine, similar to how you program like a computer with software. But it's very, very small. And it can actually go and physically bind to the DNA in the cell, and then it can actually make those changes that can actually do things like potentially cure diseases.
That's just remarkable. What's the latest with CRISPR?
Yeah, so what's really exciting is that CRISPR was originally pioneered actually by one of our co-founders here at Mammoth Biosciences, Jennifer Doudna, and some of the seminal papers came out back in 2012, and already there's now a lot of work in the clinic with the first generation of this CRISPR technology, where patients are already having the technology and benefiting from it. So I think that that's incredibly exciting, the kind of rapid progression for biotech of this technology from something that was brand new to something that's now actually in the clinic and actually kind of racing to help the patients that need this technology the most.
So what makes Mammoth different, and how is the company pioneering the next generation of genetic therapies?
Yeah, so right now, a lot of the focus of where CRISPR is being applied is what we call ex vivo. So that's outside of the body. And that means that it's a lot easier to get kind of the CRISPR technology into cells outside of the body than it is inside the body. And that's what we call in vivo. So one of the kind of grand challenges of the space is how do you get this technology where it needs to go in the body so that you can actually go after these potentially curative therapies for things like diseases in the brain or in the muscle or in the heart or in the liver. And that's where at Mammoth, one of the things we've pioneered is even smaller versions of this CRISPR technology. So it's already small, but on the scale of proteins, it can be quite big. So think of it like a semi-truck versus a little smart car that you're trying to get into the place where it's trying to go. And at Mammoth, we've developed the smart car versions that are just as effective and even have some benefits over the legacy technologies. But that's a huge kind of opening up of what's possible with CRISPR, is being able to go in vivo. So again, you can go after these potentially curative therapies.
Well, Trevor, we have to ask the question, what is the Pandora's box to gene editing, and how do you ethically keep this in check?
I think it's a great question. I think one of the things with any new technology is, right, it can be used for all sorts of applications. And at Mammoth and in general in the industry, what we're focused on is what we call somatic editing. So this is editing that is only in your body, and you can choose to get these types of therapies, and it's not passed down to your children, for example. That's one of the big areas that's kind of seen as this Pandora's box, and that's called germline editing. So that's one of the clear lines in the space. But I think taking a step back in general, these are the types of conversations where this is really more for society at large, right? Like religious leaders, community leaders, politicians, patients, of course, companies and scientists as well. And these are really important conversations to have about how do we want to use this technology and where do we want to apply it? And that's a broader level conversation.
Venture capital investments in biotech has steadily decreased over the past couple of years due to recession fears and the redirection of capital to the AI space. How are you and others in your field responding to this change?
So I think for any good company, no matter whether the markets are up or down or sideways or in between, right? Like, good technologies and good companies are going to win out. So I think you always have to take that long-term view. We're very fortunate to have a really great base of investors that have been very supportive throughout the history of the company. And I think these are kind of the exciting times. We always hear these stories about the greatest companies are built in recessions and things like that. And I really do believe that, because it does make you think about like focusing in, like, what is the differentiation? What are the things you want to double down on? And what are the things you don't want to do? And when you have a really exciting broad platform like CRISPR and like what we've built at Mammoth Biosciences, then that's really the name of the game, is like, where do you want to focus in? And I think these things can be clarifying moments. But one of the fortunate things is that we were able to raise a lot of capital over the last 5 years of the company. And obviously this CRISPR technology is incredibly exciting. So there's a very bright future, I think, for any new technology, even in a recession, that can actually have a benefit for patients.
Well, speaking of AI, how is AI being used in CRISPR research and development? And do you think it can be further leveraged?
So one of the things we pioneered at Mammoth is actually using machine learning methods to find and characterize novel CRISPR technologies. And that's how we developed that smart car versus the semi-truck. Is actually we start with natural diversity and billions of years of evolution, because these CRISPR systems, one of the really cool things is the kind of starting substrates for developing these really awesome technologies are actually the adaptive immune systems of microbes, especially bacteria. So you can actually co-opt these technologies, do a ton of engineering to them, and then use that kind of the starting foundation to actually create these tiny molecular machines that can then go cure diseases potentially for us. So there we have these giant databases of metagenomic data, just from sequencing samples from all over the world, just huge amounts of data. And basically you have to sort through that with machine learning to try and pick out what are some potentially new CRISPR technologies that could have benefits over the existing technologies, and then do a ton of engineering to those to actually develop them into the tools that we know and love. So that's an area where for a very long time, even before the company, where my co-founders were doing work at Berkeley, they've been extensively leveraging machine learning to find and characterize these new technologies that can then have differentiated benefit for patients.
And finally, what are you most excited about for the future of genetic medicine?
I think the future is incredibly exciting and incredibly bright, because even though we've seen a lot of progress, I think we're still in the early innings. And that's so exciting, right? Because there's even just 4,000 rare monogenic diseases. And imagining a world we could live in where all of those could actually be potentially cured is incredible, right? And then you can start thinking even beyond that towards more common diseases and things where we want to reduce the risk of things like heart attack or cancer. So I think being able to program the code of life the same way that you kind of program a computer with software is an incredibly powerful concept. And it means that going forward, biology is going to be very similar in terms of, I think, the just massive and rapid progress that you see kind of on the more software and tech side going forward over the next few decades. And that's, I think, incredibly beneficial for patients as well.
Well, Trevor, you know what else is exciting about it? When I think of biotech companies, you kind of have the science and the medicine side of the management team, and then you have your traditional investing and business side of the team, but you don't think of it, as you've been explaining, from the engineering, the technical side of it. So I think it's fascinating in that respect as well.
Oh yeah, absolutely. And I think that's one of the beautiful things going on right now, is that marriage of kind of engineering and computational sciences and biology, where, often in high school we're taught biology is like stamp collecting, but it's not. It's actually this engineering discipline where we can really kind of make these huge leaps and bounds in terms of understanding the fundamental causes of disease and actually being able to tinker with the code of life and modify it so that we can have an incredible benefit for patients that are suffering from these diseases. And that's super motivating. And I think it really shows how over the next few decades, there's going to be immense progress in the field.
All right, Trevor, we appreciate the insight. Thanks for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.
Thanks for having me.